who receive some of the healthcare benefits that we have come to offer in this country. I think we pride ourselves on having a universal healthcare system, and I think that is being systematically shredded apart. And they are starting with the most vulnerable. They're starting with refugees, and I think this is intolerable.
So why did you decide this press conference is time, knowing that, why this issue? Why did you decide to storm in today?
Because we believe as medical professionals and we believe it is not right for this government to be able to get a platform like this. We believe that they need to be held to account. Lives are at stake here. This is not something that I enjoy doing. This is not something I would do as a hobby. This is something I'm doing out of my feelings of professional obligation. I have an obligation in my profession to do no harm, and most importantly, to alleviate the suffering of others. And this legislation is going to cause so much suffering. I could see 2 or 3 patients in the time I'm here. That would be important. But these cuts are going to impact thousands of patients across this country, and I'm not ready to allow that to happen. For this minister to be able to proceed uninterrupted and make his public relations bid.
Did you feel like the media hadn't heard you up until now?
The media will continue to hear from us.
But obviously you felt the need to sort of storm in when you knew there would be a lot of cameras.
I came, I took my seat, and I stood up because I could not remain silent in the front of this.
What do you think of his explanation that they will get health care?
This is absolutely untrue. The Canadian, they have released documents which clearly define what kind of care will be available. So for instance, a diabetic from a country which is not a designated country of origin will not receive insulin. If a type 1 diabetic does not receive insulin, they go into something called diabetic ketoacidosis. They show up at my emergency department near death. Supremely dehydrated, acidotic, they need to go to the intensive care unit. What the government is saying, this will save $20 million over the next 5 years, a sum of about $100 million. This is untrue. These costs are going to be offloaded to provincial healthcare systems, to emergency departments, to intensive care units, where people are going to be coming in health crises because they did not receive the preventative healthcare benefits that would keep them healthy and keep them out of hospitals. This isn't just about money. This government is going to lose money on this. Well, it's going to offload money to the provincial governments. This is also about patient care and patient suffering. And I will not stand by and allow these cuts to carry through and the kind of suffering that will follow from them.
Tell us your name and what emergency department you work for. What's your job? What do you do on a daily basis?
My name is Dr. Keefer. I've just been boarded in family medicine. I work out of Brampton Civic Hospital through the Brampton Family Medicine Teaching Center.
Are you worried you might lose your job by being so vocal?
No, I don't think I will, because I'm supported by position statements by the Canadian Medical Association, the Ontario Medical Association, the Canadian Psychiatric Association. We have broad-based support, unprecedented support from medical associations across this country.
So how come the conservatives don't even listen to those organizations?
Because I think they're driven by a very ideological platform. They're trying to divide Canadians. They're trying to turn us against each other, and they're eroding some of the most basic institutions which make us proud to be Canadian, such as universal health care.
What do you see in your emergency room? You work in a community that has a very diverse community.
Absolutely.
You must see a lot of this.
Yes.
That's what's motivating you?
Absolutely, yes. So, I also work in a family practice. I saw many patients without formal healthcare benefits, healthcare coverage, immigrants on a 3-month waiting period, for example, who were not receiving basic maternity care. So when you have a woman who comes in and she starts to develop hypertension, she's in her 3rd or 4th month of pregnancy, this is something we can pick up early. It's very treatable. We can line her up, she can get good care, she can deliver a baby safely. Okay? What these sort of cuts do is mean that there will not be preventative care for mothers who are pregnant. And if they start developing hypertension, they'll come in something called preeclampsia. They'll start having seizures. They may lose the baby. The baby may be very sick. The baby may end up in a neonatal intensive care unit. This is something which is not going to save any money. And more importantly, it's going to cause immeasurable human suffering. And so I can't sit by in a news conference, as important as it may be. We need more medical isotopes. I am 100% in agreement with that. But at this moment, this legislation, Bill C-31, is going to be passed in days, in a matter of days. And so I feel that this is a matter of sufficient seriousness and urgency that I need to stand up for that.
And what is your first name?
Chris.
Can you spell your last name?
Keefer, K-E-E-F-E-R.
And are you C-H-R-I-S?
That's right.
Okay.
Great, thank you.
And
Can we
who's
talk-
your